Hello, everyone. It's Wednesday, November the 11th, Veterans Day, a day that is close to all of our hearts, and I'll get to that in just a few moments. Since Monday, we've lost another 23 West Virginians. You can see on the television all across our nation, this thing is amped up, and it keeps getting worse and worse. We're all very, very hopeful that it will, as it's done in the past, it will peak, and then it'll go the other way. But right now, we're still going up. We've now lost 553 West Virginians. Our 531st death is a 96-year-old female from Boone County. Our 532nd death, a 75-year-old female from Boone County. Our 533rd death, a 92-year-old male from Wetzel County. Our 534th death, and listen to this, a 47-year-old male from Wetzel County. Our 535th death, a 79-year-old female from Boone County. Our 536th death, a 65-year-old male from Preston County. Our 537th death, a 65-year-old male from Marshall County. Our 538th death is an 85-year-old male from Wetzel County. Our 539th death, a 79-year-old female from Fayette County. Our 540th death, an 85-year-old female from Putnam County. Our 541st death, an 81-year-old female from Ohio County. Our 542nd death, a 78-year-old male from Hancock County. Our 543rd death, a 72-year-old female from Raleigh County. Our 544th death, a 76-year-old male from Kanawha County. Our 545th death, an 80-year-old female from Kanawha County. Our 546th death, an 88-year-old female from Summers County. Our 547th death, a 71-year-old male from Cabell County. Our 548th death, a 67-year-old female from Mingo County. Our 549th death, a 70-year-old female from Cabell County. Our 550th death, an 84-year-old female from Cabell County. Our 551st death, a 41-year-old male from Raleigh County. Our 552nd death, an 80-year-old male from Wyoming County. And our 553rd death, a 71-year-old female from Kanawha County. All these people range in age. We have absolutely dialed in, no question, that our elderly are the most attacked by this killer. We have a 96-year-old and many in 92, many in the 80s and 70s, but just look. We have a 41-year-old male and a 47-year-old male that we've lost as well. So this killer is with us. We got to continue to try to do everything we possibly can that we have up on our guidelines, and we have got to do everything we possibly can to be tested so that we can absolutely isolate people that have this disease that don't know it, that are continuing to spread it. But today, just like many days, and the last little bit especially, have been a really tough one. So please keep all these people in your thoughts and prayers. Please, please do. We have had 885 new positive cases in the last 24 hours. This is a record beyond belief. Our daily positivity rate is almost 6%. Is it at 5.90%? Our cumulative positive continues to rise and is at 3.11. We have active cases now of 7,771 cases in West Virginia. We have hospitalized patients of 277. And yesterday we did test in excess of 11,000 people. That's why we're finding all of these additional positives. It will pay big dividends for us if we will just continue to test. Now, our RT number or our reproduction number is at 1.08. That's better. It's the 13th best in the country. Now we only have one county in the red, is Mingo. We have 9 in the orange. That's Ohio, Mineral, Tyler, Wood, Jackson, Nicholas, Fayette, Lincoln, and Wyoming counties. On Tuesday, the number of people with COVID at U.S. hospitals topped 60,000 in the country. That's 2,000 more than were hospitalized on April 15th when this thing was running like crazy and you were watching New York and people dying all over the place. Texas has become the first state in the United States to record 1 million COVID cases, according to Johns Hopkins. We got a real problem, a real problem. And I know there's experts all over the place. I've got a couple of them with me today, but there's experts all over the place that are trying to do any and everything we possibly can to stop this. Again, encourage all West Virginians, especially before this holiday period, to take us up on this free testing and get tested. You'll see on our website, when and where we're going to be. The drive-through pharmacy testing is also available to you. We have 18 outbreaks in our schools. We have now jumped up to 118 confirmed cases. They're all up on our website as well. We have 72 long-term care facility outbreaks. We have 19 outbreaks now in 13 counties in our churches. Those are Cabell, Fayette, Hardy, Jefferson, Kanawha, Lewis, Mingo, Monroe, Raleigh, Ritchie, Tyler, and Wood and Wyoming counties. And again, I encourage everything I've said over and over. There's no point in continuing to repeat it. You've heard me 1,000 times about the pews and the mask, and please do that if you're going to go to church. The Stevens Correctional Center, which is operated in McDowell County, has reported an outbreak among both inmates and staff. Stevens has 38 inmates and 11 staffs, that are positive. I got a call from Cecil Patterson. Cecil's with the county commission and does a marvelous job. He's a good friend. And the second that I got a call, we ran to the fire, and that's what we'll do and do always and everything. Outside of this outbreak, we only have 6 other inmates and 34 other staff cases all across our state. Like I said, at Stevens, right there in McDowell County, we have 38 active inmate cases and 11 staff, and the odds are, the way this normally works, it's probably going to get a little worse before it gets better. But nevertheless, I appreciate Cecil and notifying me, and we were able to jump on this. I'm sure they notified all the health officials as well, but we were able to jump on it. The National Guard is standing by to sanitize once the outbreak has been isolated and the scope of the infection is known. So, the National Guard will do great work there as well. We are now at 175,698,000 plus as far as it's been awarded to our cities and counties. We need them to continue to do what they're doing and apply and everything. I got to say this, right outside today, we've got a bunch of wonderful kids, wonderful kids that have been dealt a tough hand. You know, they're athletes that participate in athletics, and I know how hard they work because I coach all the time. You know, this just happens to be a bunch of young girls. I coach a girls team. I absolutely understand how hard that our girls work, absolutely just as hard as the guys, because I've coached the guys as well. Now, I can tell you just this, that, you know, all of us want them to be able to play. But at the same time, we're trying with all in us to keep some level of protocol that we have put in place to be able to ensure the safety of all of us. You know, these counties, you know, they had testing options to where they could have flooded the place with tests. We would have found more people. We would have been able to help those people. The number of tests would have surely impacted and helped them from their color coding and all that kind of stuff. So there are many, many, many different avenues that we could have gone here. But the bottom line to the whole thing that we cannot lose focus with is I just read another 23. You know, on Monday on Monday, I read some cases that we, you know, had backlogged or missed or whatever, you know, or maybe the reason had just gotten determined, or the local health people or the hospitals rather didn't fill out the death report and everything, and it just got to us and everything, and we kind of, you know, ferreted it all out and everything and figured it out. But in that, I read off 44 people that we've lost. Today, another 23. Our positivity rate cumulative is at 3.11. We have 885, I think is what I said, tested positive in the last 24 hours. Let me tell you, first and foremost, in regard to our kids, we need to try to be in school. And if we can't be in school, the last thing on earth we need to be occupied with is a ball game. Now, I understand with all in me how bad and how tough these kids are hurting, because we had to pull the plug when my team was getting ready to play in the state tournament. You know, and those kids work really hard to get there. I hate it more than you'll ever know for those kids, because they are in many ways innocent bystanders, and really and truly, that's just all there is to it. There's not much that I can do, you know, because we have absolutely vetted this with every possible expert in the world, and the experts' decisions, you know, were to hold tight with right where we're at in an effort to try to do something about this dreaded killer. And it makes no sense to anybody for us to not be in school but yet be out trying to play a ball game. It's tough stuff. Tough stuff. But nevertheless, if I jump over to Veterans Day, you know, and do I want to do that now, Jordan, the Veterans Day? Okay, well, I just, you know, my notes here say, please join me on this Veterans Day in thanking the men and women that have served this country, or that have and are serving in our Army, Air Force, Navy, Marines, Coast Guard, you know, and I guess in our Space Force as well. I mean, you know, and so, but it is a day of thankfulness that every last one of us should absolutely feel to our heart. What these wonderful men and women have given and give and will continue to give us in each and every way is everything we have. Everything we have. I've said it over and over. We owe everything in this country to these great men and women that have stepped up and served, and many of them have absolutely paid the ultimate sacrifice. And so for their families and everything, let's remember them, and remember them in your prayers as well. And again, I can never possibly thank them enough. Today at 1 p.m., we will have a special Veterans Day ceremony. And I encourage all of you to watch on whatever channel you're watching this briefing right now. So at 1 p.m., you can join all of us in a special ceremony and for this absolutely wonderful celebration of a wonderful, wonderful day. So that's all I've got right now. And again, I hate it for those kids, and daggone, I hate it for our schools, and we got to some way stop this thing from the standpoint of hating it in every way for all these names of people that we've lost that we're reading. Thank you.
All right, thank you, Governor. Let's now go to Dr. Clay Marsh, our coronavirus czar.
Well, good morning. It's good to be with everybody, and I'd first like to send my appreciation and for our leadership team and university and state, for General Hoyer and all the veterans out there on this very special day. It's a sober day, though, and I think that you got that from the governor's tone. When we look around the country, we are seeing more people infected with COVID-19 than we've seen at any other part of this pandemic. Over the last 8 days, we've had over 100,000 people test positive on a daily basis, which is more than any single day before then. We see more people, as the governor said, in hospitals in our country today than we've seen at any other point in the COVID pandemic. And we see it getting worse, not better. As we look in West Virginia, we are seeing an all-time high this past 24 hours in the number of people that have tested COVID positive, and we are at an all-time high weekly average. And it tells us that West Virginia, while people have done well, and we're so proud of our citizens' actions and working together as a community of West Virginians, that we need to step it up. There's really 4 parts to an effective strategy map with COVID-19. The first part is extensive testing, and the governor's gone over that, and we need to continue this so that we can identify people that are super spreaders, the 5 to 10% of people that spread to 80% of others, oftentimes when they are asymptomatic or pre-symptomatic. The second area is very effective contact tracing, so we can identify those people and their contacts so that we can remove them from other people that they may infect unintentionally to try to reduce the rate of spread of COVID-19. The third part, which is really important, which is the part that we constantly ask about, but it's important that we continue to encourage each citizen out there, which is mitigation. And mitigation is the wearing of masks and staying physically distanced and avoiding the 3 C's, the crowds, closed indoor spaces, and close contacts of others. We know that today, many of our deaths are happening in nursing homes. When we look at all of our outbreaks, over 80% of the people dying are from nursing homes, and the majority of people that are bringing the virus into nursing homes is happening from the community, happening from community get-togethers of friends and family members where people are not being as cognizant of wearing masks, from indoor environments where people are taking their masks off, and we know nationally that includes restaurants and bars and coffee shops and gyms. And this is really a time that we have to be even more committed to controlling that spread. The governor talked last press briefing about the exciting new understanding and observations from the vaccine trial, particularly from the Pfizer vaccine, but just recognize that even though that is a very encouraging trial, not all Americans will be able to get immunized right away, and it will take a while for the 2 immunizations to get done. And therefore, in the meantime, as we very much await that very important part of our mitigation strategy, which should help reduce the infection in the country, that we need to serve that span, that gap between the time that we get everybody immunized and today by wearing masks and staying physically distanced. And the last part of an effective strategy is to pay close attention to hospital capacity issues. We know in countries and in states where we see surge happen and when we see hospital capacity start to be constrained, not only on the number of beds available for critically ill people that need the most complex and best care that we can give, but also on the staff, because people from the hospital also get infected, oftentimes from the community. So protecting our vital workers, whether it's hospital workers or first responders or other health workers in nursing homes, assisted care facilities, or in schools or other important parts of our ecosystem in the state of West Virginia. So as we look at hospital capacity, we see that there's more people with COVID, confirmed COVID, and with probable COVID than we've seen in the past several months. And so we are very closely watching that because it's about a 2 to 4 week period between the time that you see a lot of new positive people and you start to see a bit of a surge at the hospital level. So all in all, West Virginia, you're doing well, but we're starting to see that the deaths are rising, our hospital numbers are starting to rise, and we see spread that is very much throughout West Virginia and throughout our country. So it is really time for us to rally together and answer this call to service on this very special Veterans Day. And as you have served before, our country and our world and our state, please serve again. Thank you.
All right, thank you, Dr. Marsh. Next to Major General Hoyer with the West Virginia National Guard.
Good morning. This morning I'd like to just focus a little bit on the significance of Veterans Day to us as veterans as it relates to context of this pandemic. For most all veterans, Veterans Day is not about the parades, the days off, or people even saying thanks. It's about recognizing that ordinary people stepped up and made extraordinary sacrifices. They took on additional extraordinary service, and they took on the responsibility for others so that we could all have freedoms and rights that the governor mentioned earlier in the comments. So for us today, I would hope that we take two things. One is the pain that if you watch closely, you see in the governor's face with each name or each individual that he reads on each of these events, and that extraordinary sacrifice of ordinary people, our veterans, and put those things together as a motivator for us all individually to take on the responsibility of doing the things that the governor's asking us to do that we know help us mitigate the spread of this virus, and to reduce, to eliminate the fact that our governor has to get on every day and read individuals who we've lost during this pandemic. I thank you on behalf of all veterans for the things that people recognize, but I ask us on behalf of all veterans to take on that responsibility, do the things we need to do to address that threat. Thank you.
Thank you, General. Next to Dr. Ayn Amjad, our State Health Officer.
Good afternoon. I do want to thank General Hoyer and all the veterans who are listening, and thank everyone for the service and the sacrifice for our country. And they are the example that we do need to follow for the services that they have provided, and that we do need to follow their example to continue to fight during this pandemic, because as General Hoyer did mention, this is a time that we need to continue to fight and move forward in order to get through these next few months during this COVID-19 pandemic. I do also want to mention we did put up on our DHHR website a holiday guidance document for people who were asking to have some recommendations for Thanksgiving and the upcoming holidays. You can find that on our website under information and public guidance documents. If you are going to see your families, then we do recommend a few things, such as only to stick around immediate family members. A few other things to mention are if you had COVID-19, especially within that diagnosis frame, to obviously not go around any family members. If you think you've been around anyone with COVID-19, to not go around any crowded members. Also, if you've had a test recently and been symptomatic, to not go around any family members. Also, if you've been planning on going to see anyone, we do recommend going to get tested, and also maybe going within 5 days, because we don't know the time lag between getting test results right now. We have been seeing a shortened time, maybe 2 to 3 days, but we don't know if it's going to take longer. So those are a few things that we recommended, but we do have our holiday guidance up on our DHHR website right now for anyone to view that. Thank you.
All right, thank you, Dr. Amjad. Secretary Bill Crouch with the West Virginia DHHR is also joining us today and is available for questions. We'll now go to questions from members of the media. The first today from Charles Young with WV News.
Hi, this is Charles Young with WV News. I wanted to ask about the testing capacity at our pharmacies. I know when we talked about it, I think it was a week ago, we said there were some locations that had the ability to do less than 40 tests a day. Where does that stand now? Thank you.
Maybe, yeah.
So, Charles, we continue to increase the number of pharmacies that are participating. We are currently, DHHR, and I'm assisting them, are putting together an initiative with an additional pharmacy chain. We're looking for pharmacies that can increase that capacity. In addition to that, we have additional clinics and federally funded healthcare facilities coming online, and we are working on an interactive map that will be available that you can look at each county and you can see where you can go to be tested. So those pharmacies that can increase capacity, we will continue to work with to grow them as we go forward.
All right, thank you, Charles. Next to Kenny Bass with WCHS and Fox 11.
Hi, this is Kenny Bass with Channel 8 and Fox 11. I very quickly want to say thank you to Major Hoyer and the West Virginia National Guard, the veterans, for their service. I was honored to travel with them to Afghanistan and Kuwait, all around the world, and there's not a better group of people. So thank you very much for your service. I have a question for Dr. Marsh or Dr. Amjad. Obviously, Dr. Marsh, you painted the picture of what you've seen. Can you dig a little more deeply into the trend that the state is facing? Obviously, you've said many times that when you have more testing, you get more positives, but we're also hearing of community spread, small gatherings of family and friends, which Dr. Amjad just referenced, talking about Thanksgiving. So how can we tell what more positives are coming from increased testing and what positives are coming from that community spread? And what are the trends showing you as far as number of cases, positives, and deaths that if things don't change, West Virginia is facing, say, over the next month or so between now and Christmas or the new year? Thank you.
No, go.
Okay. So thank you, Kenny, and I'll start, then please add in. So as you have very nicely asked, Kenny, that we understand that while increased testing does identify new cases, that those new cases are real activity in the state of West Virginia. We have seen, as we've said, the highest single week total that we have seen in the entirety of the COVID pandemic over the last week, and today, over the last 24 hours, is the highest single day total. We have seen our cumulative percent positive rise from well under 3 to now over 3. And that's been kind of an inexorable climb, which demonstrates that at a percent of all the tests we're doing, we're seeing more positives, which implies that it's not just a proportional more tests, more positive cases, that there's actually more disease in the state of West Virginia. Now, identifying those new people is spectacularly important because, as we've talked about many times, 50 to 75% of the spread of COVID-19 in any community is mediated by people who don't know they have the disease and are a real small percent of the entire population of people who may be infected, these people called super spreaders. And so it's really important that we test broadly to identify this subset, which can really start to get a better handle and reduce the spread of COVID-19 in West Virginia. We know from national data and from our own epidemiology data that outbreaks are generally started in community settings. In community settings, as we've talked about, like family or extended friend gatherings, Halloween parties, in bars, in restaurants, in gyms, in coffee shops, and we know that this is getting more widespread. And we believe that although I know that many people are working very, very diligently to maintain and to follow all of the things that we've asked, that people get tired and get tired of wearing masks and get tired of physical distancing. And those are the things that start to drive that spread too, because remember that spreads through droplets. And there's a new CDC study that says that masks not only keep you from generating more droplets, which protects other people from you, but also blocks droplets coming into you, so protects you from other people. So it is getting more clear that wearing masks is not just a source of altruism to care for others, but is also a way to protect yourself. So I think that this, even though we have tested more, which is super important, we are seeing more spread in communities, and we believe the modus of community spread is really being generated by gatherings of people who are getting close to one another and not wearing masks as we have asked them to do. Hein?
The only thing I would add to that, Kenny, is that we've asked people in communities to not gather in large groups and just stick to their immediate cohorts or family members, to try to avoid any large gatherings, to wear their masks and to really social distance. A lot of people travel even in cars to work together, that if that's the case, to wear your mask in your car. It is uncomfortable at times, but to just avoid any large gatherings. It is spreading throughout those modes as well. People do want to have some type of parties. We understand those reasonings, but those are the spreads that we are seeing in communities. But you have to wear a mask and social distance if you're going to be gathering in those ways. Thank you.
All right, thank you, Kenny. Next to Brad McElhenney with West Virginia Metro News.
Hello, Governor. Hello, everyone. Just wanted to wish everyone well on Veterans Day, particularly General Hoyer and the National Guard in West Virginia, which have been working so hard the last few months. On to my question. A couple of days ago, Governor, you revealed that 27 COVID-related deaths that had occurred over prior weeks and months were being added to the state's total for the first time because they had not been reported up from the local level until now. Over the summer, a similar situation arose with the inaccuracy of coronavirus figures that was overstating some active cases in a particular county. At that point, you said you lost confidence in the state health officer, prompting her dismissal. I want to make clear I am not advocating for the dismissal of the current public health officer, but I would like to hear an explanation of the consistency. If there's a data discrepancy, what's the difference? Thank you.
Well, Brad, you know, I'm surely not going to get into all the particulars, but you've got to just entrust in me that there was many additional reasons. You know, this was not like all of a sudden we just ended up with an inaccuracy, you know, and therefore we decided to go another way. You know, Dr. Schlemp is a good person, and we appreciate her service in many ways, but trust me, you know, there was a lot of consultation with all the people that were on board, from, you know, Dr. Marsh to Secretary Crouch to on and on and on, you know, to the people within DHHR, and there was other issues, and the accumulation of all of it led to the dismissal. So I am very, very confident in Dr. Amjad and the great job she's been doing, and really and truly, I think what we have discovered here, and we brought it to you, is the fact that that agencies, you know, down on the county level, you know, or hospitals had not properly sent in the documentation, and considering, you know, that's a very valid explanation, and when those things happen, we want to be completely transparent, and so that we have you know, scrubbed the system to look even harder and everything, and when we find something, we're going to tell you.
All right, thank you, Brad. Next to Mark Curtis with Nexstar Media.
Good morning, Governor. Good morning, Cabinet members. I'm sorry I missed most of the briefing, and I apologize if I asked something that's already been addressed or asked. But given the big spike in numbers, and obviously this 850 plus number from today is a new record for the state by 200 some people. Are you giving any more shot? I know I've asked this question before, but things keep changing. Are you giving any more thoughts to shutting anything down in the state, restricting travel, bars and restaurants? I mean, what's on the table?
Well, Mark, I'd tell you that everything's on the table. It's always everything's on the table, and I don't mean to give you the same kind of pat answer all the time. You've got to understand the big spike in numbers is driven by the fact that we tested 11,000 people. We're not testing 3,000 like we were. We're testing 10,000, and when we're testing 10,000, we're going to find people that have this dreaded disease. And so with all that, we're continuing in every way to look at each and everything, as far as the possibility of shutting something down or whatever it may be. I just go back to just simply just this. And like I said, I think these kids are innocent, bystanders. But at the same time, you've got a situation right now where you've got a state volleyball tournament that's going on or going to be going on. From the standpoint, you've got kids that aren't in schools in these counties. So if you opt out to play sports and not go to schools, that doesn't make any sense. But what doesn't make any sense even more than that is we could go test all these kids, which I would be all for. And then we could say the kids are good to go. But right behind that, then there's another element, and that is what if we show up at the games and somebody from the county that's completely asymptomatic, they come in and then they infect more people. There's so many ramifications, but Mark, we're watching everything. Dr. Hoyer, General Hoyer and Dr. Marsh can weigh in as well on some stuff here, and I want them to do that. But we are watching everything, and absolutely, I want you to know that everything's got to be on the table. Everything's got to be on the table. If we continue to rise the way we're going and everything, it ultimately will come to at some point in time that we'll have to look awfully hard at shutting things down. But right now, we sure don't want to go that way if we can possibly avoid it. But General Hoyer, if you'd like to add anything, or
Mark, just reinforce what the governor just discussed. We're looking at, as we talked about from the previous question, we continue daily to add pharmacies, test sites, places to get more testing done. We continue daily to work with nursing homes and hospitals to do different mitigation strategies to reduce spread and God help us reduce the number of deaths that we have. So we continue daily. Part of the reason that Dr. Marsh and I are here today in person is to work specifically on some other issues with the governor related to that, along with Secretary Crouch and Dr. Amjad.
All right, thank you, Mark. Next, we'll go to Stephen Adams.
Dr. Marsh, may want to weigh in on that too.
Yeah, thank you, Governor. And the only thing that I wanted to add, and we've said this from the very beginning of this pandemic, that an amazingly important component of whatever we choose to do in the future, and I think the governor has been masterful in his approach here, is it is really, really critical that we keep our state together. If we're basically, he would say, pull the rope in the same direction, there's a lot of pithy metaphors that I could use, but the foundation is everything that we both read and everything that we know says that if we fracture ourselves, if we become a house divided, then we lose our strength. And so as we go forward, with the strategies that the governor feels are the right strategies to reduce the spread, person to person, county to county spread of COVID-19 in West Virginia, and save lives and improve the well-being of our population. It is critically important that we do this in a way that helps maintain the community, the togetherness, the strong connections that we have as West Virginians together.
Another thing, one other thing from the standpoint of what, General Hoyer mentioned, but the reason that General Hoyer and Dr. Marsh are here in person today is, we're talking nonstop, and we just meet and talk and try, but we've got a few possible new ideas and things we can discuss and make things just one notch better. So we've got a meeting set up for 3 o'clock today, and we're gonna work on it even more. But we're working. I mean, people are working on this round the clock. But thank you so much.
All right, thank you, Mark. Now we'll go to Stephen Adams with Ogden Newspapers.
Hello, Stephen Adams with Ogden Newspapers here. I'm hearing from local county health departments, smaller health departments in my readership areas, some concerns about, especially since they are fairly small staff organizations, that they're having a little bit of a hard time in regards to testing events, especially since they say that there is a very short timetable that they have to when they're approved to when they get the word out, which sometimes is 24 hours or less to let their communities and their areas know that the free testing is available, which is what's causing a lot of the issues with smaller turnout at these testing sites. I think Katie Coyne with the Gazette-Mail has a similar story from some southern West Virginia counties as well. Is there a better process for trying to get these testing sites set up and try to, especially in the smaller counties where the staff is somewhat limited, the ability to get these scheduled and get the word out well before a 24-hour basis of time? Thank you.
Maybe General Hoyer is going to answer this, please.
So, Stephen, I think it goes back to Charles's questions and others, and what we continue to reinforce is the governor's pressed us early on to push assets in surge capacity to get testing moving, and then at the same time look at how we create steady state capability within counties that minimizes the impact on local health department staffs. And that's why you hear me talk about us continuing to try to bring more pharmacies online. DHHR is bringing 4 new pharmacies online today. We're talking with one of the pharmacy chains about bringing as many as 58 stores online across the state. We already have Walgreens and Fruth. We're looking at others. We've continued to add local clinics as well as federally funded healthcare clinics, and we've got to get to that steady state embedded within communities to address what you just described, and that's what the governor's been pressing us to do and to press forward with.
All right, thank you, Stephen. Next to Brendan Tierney with WSAZ.
Hello, Brendan Tierney with WSAZ here. My question's for the governor. Governor, you had been greeted at the beginning on your way into the Capitol today by a number of players from different high school volleyball teams in Putnam County talking about their desire to be able to take the court despite their county being not allowed to do that from Saturday's map. On Monday, you said that you would make some changes and look into things, and you told them that you really weren't able to make any progress done. So I was hoping you could give us a little bit more details on what exactly you and your office did between Monday and today, and the reasoning behind football players being allowed to possibly change their color on Saturday to play games on Sunday, and why it's different for girls volleyball here.
Okay, I'll take my best shot, at trying to explain, because I think everyone deserves that explanation as best that I possibly can tell you. First of all, I hate it. I hate it like crazy because I know how much these kids give, and I know how hard they work, and I know that they're student athletes, and I know it firsthand because I'm the coach. I hope to goodness that they'll always trust me from the standpoint of telling the truth as best I can. Now, if I go back to the Saturday map that came out, I was notified, and I get notified, first of all, Thursday night at midnight, we cut it off. And then from that point forward, then DHHR amasses the information. Then it goes to a panel, and they review that information to make sure of its accuracy or make sure that there's not an exception that where we can move a county into a different color. Now, that expert panel is doing terrific work, and they either get that work on late on Friday and then through Saturday morning up until noon. And at noon, Dr. Marsh calls me and gives me a report of the counties that we have and that are in the red, in the orange, and in the gold. At that point in time, then what I do is I tell Dr. Marsh, I said, wait a minute. This county is so close. This county has tested so much. Is there not any way to go back and look and dig even deeper? And so that's what we did. We went back and we started through the process of digging deeper and deeper and deeper. From the standpoint of Putnam County came back, that we could not get them to a better color from the standpoint of where their numbers were. From the standpoint of Berkeley County, we had a bunch of tests that got hung up, and we were waiting to have those tests confirmed. We were told that those test results were a certain level, but if we went with that at 5 o'clock on Saturday, we would have said Berkeley County's in the gold. We wanted to make absolutely certain that those tests were right, and so that's why we delayed, and that's why we didn't come out until later on Saturday evening, not because we were wanting to make sure that the tests, that we were trying to get more tests in to do something and move Berkeley to a better number or a better color. We were told that the tests were like 800 tests. I can't recall exactly what it was, and that only like 30 of those tests were positive and all the rest were negative. And if we put that in, Berkeley County would have immediately become gold. We wanted to make sure that was right. And so we kept working it, and finally, we absolutely were positive that it was right. And so we went at that point in time. Now, from the standpoint of the SSAC, and they have continually made moves where they have moved out the soccer tournament or moved out the volleyball sectional or the volleyball regional and everything, and along the way, they have done that repeatedly. Now, the situation now with football is just this. Football doesn't have a sectional and doesn't have a regional and then has a state tournament. Football just all starts their state playoff at one time, all at one time, all their teams. Now, with all that, and this is what I've been told, with all that, what they decided, unbeknownst to me, totally on their own, was to move the thing to a Sunday date. Well, in their defense, on their behalf, is just what I just said. Football doesn't have a sectional, regional, and whatever, and we've already done this for soccer. We've done it for volleyball and sectional, regional, and this basically is their sectional that's coming up. And so, therefore, they feel like that was the right thing to do. Now, from the standpoint of the Department of Ed and our medical experts, Everybody met and talked and discussed all this and came to me with the recommendation that that is correct and the correct thing to do. From the standpoint of the volleyball situation, if in fact we moved the volleyball situation again, you know, what would happen is just this, and I don't know how you get around this. This is the problem. This is the dilemma, and it is the dilemma that is eating all of us up. And it's just simply just this: teams that have qualified as of today, teams that are in school as of today, are in our state tournament. Now, what if a team that was orange now, that is ineligible right now, what if that team, if what we did is we tested that team and they were okay to go, or we moved the date, and let's just say we moved the date and another team that was eligible today became orange at that time. What do we do? What do we do? You know, we could go back and we could forfeit both teams. You know, we could forfeit one or the other. But that team, as of right this minute, is eligible to play. You know, it is a dilemma beyond belief. You have the dilemma of we were going to put sports in front of school. Ridiculous. You can't do that. We've got these kids that aren't in school right now. I mean, if they're not in school, how in the world do we make it right for them to be able to play sports? The other flip side of it is just this, is what do we do with the parents and the fans and everybody that wants to come from these counties that are absolutely, we know, are orange or red? What do we do? What do we do with all the teams that we've already, because the map has been worked against them and they've had their teams been nullified already. There's so many aspects of it, but what we did is just this. What we did is we went right back to the well on Saturday over and over and over, went right back to the well over the weekend as well. We have absolutely discussed this. For crying out loud, if anybody in their right mind would think that Jim Justice doesn't want these kids to be able to play, they're crazy. I want it so bad it's unbelievable, because I know how hard they work. But Jim Justice also has to make really tough calls and tough decisions. And really, in this situation, Jim Justice has got to protect us in every way from dying. From dying. I have read name after name after name after name. We have had every opportunity in these counties, and I have been out here in front of you over and over and over saying, test, 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 and in a lot of situations, we didn't do it. And in a lot of situations, I've said, wear your mask, wear your mask, wear your mask. We didn't do it. Now we've got crunch time and tough decisions to make. But I can assure you without any doubt, our team, these medical experts, the education experts, the SSAC, all of us have worked this every way we know to work it. And unfortunately, this is just the very best that can be done today. And I think it's Brandon, or and I'm not sure exactly, but I thank you for the questions. I love these kids to death. I hate it, I hate it, and I hate it. But really and truly, first and foremost, I want our kids to be able to go to school. I naturally want them to be able to play ball. I want the deaths to stop. I mean, for crying out loud, I know our sports are really important, but they've got to take a back seat to this situation that we're in. We've got to all realize we are in a pandemic, and it is killing people. It is killing people to the tune. I mentioned the Sago mine. For a lot of you that are out there that remember the Sago situation, we had 12 miners trapped. One of them survived. We thought we found them, and all 12 were alive. Everybody was celebrating. Days went on before we found them. And then everybody was screaming, they're alive, they're alive. And then we found out they weren't. 11 out of 12 of them had passed. And one was alive and then ended up with many, many complications. It dominated our prayers and our airways for days. Do you realize we lost in the last 2 days 2 Sago mines? 2 of them. That's the magnitude of what's going on here, and too many people are focused on situations, well, we need to play ball, we need to do this, I'm not wearing a mask, whatever it may be. We've lost 2 Sago mines in the last 2 days. Some way, somehow, somebody's got to make a tough decision. I take the very, very best that I can possibly take as far as a recommendation. The recommendation all came to me that we need to stick with where we're at, and absolutely with all in me, I am willing to make those tough decisions. If everybody wants to put this right at my feet, they can. That's okay with me. I'll make the tough decisions because I'll do the right thing for our state.
All right, thank you, Brendan. Next to Paul Mullen with WCBC.
Good afternoon, Governor. Good afternoon, panel. On Veterans Day, I have a question for General Hoyer. First, I want to start with a thank you for your service, sir, and your guardsmen, and also to all military out there. We appreciate so much what you do. General, do you see any parallels between a traditional military operation and the battle against COVID-19?
We see all kinds of those every day, and if you look at how we present information and how the governor runs the operation, we are focused in a military structured manner as to how we respond to things daily. We have regular daily and every other day updates that use joint task force constructs where DHHR and the National Guard and other agencies participate. So, Paul, I think it's similar to any type of war response that we have. I think maybe generally people don't see it that way, but that's how we focus it at the governor's level and our leadership level.
All right, thank you, Paul. Next to Jeanette Dill with the AP.
Hi, Governor. Thanks all. I wanted to ask, at this point, do you acknowledge Joe Biden's victory of the election? And if so, how do you plan to work with the president-elect's approach to the coronavirus pandemic? He has a task force and he wants to double down on mask wearing and testing, which is sort of what you've talked about as well. Are there areas of agreement or disagreement on his plan so far? Thank you.
Well, first and foremost, let me just say this, and this is not a bias towards the fact that I really supported our president. I really supported President Trump. I thought he did a lot of good things, and at some point in time along the way, there was things that President Trump did that Jim Justice wouldn't have done, and I'm sure that Jim Justice has done things that the President of the United States would have surely not done. But with all that, I would just say the reason I go into that is I tell you just this is not a bias because of how I feel about our president, but as far as acknowledging, that the election is over, I do not do that. And the reason I don't do that is because truly, with all in us, we want to absolutely know that the votes that were cast were legal votes. And we want our election process to be absolutely sound. We do not want to walk away and say, well, it really was rigged or this or that and everything else. We don't want that in America. And I hope to goodness that Joe Biden doesn't want that. Now, at the end of the day, we'll get to a conclusion about this in the very few, probably weeks and not days. But when we get to that conclusion, if Joe Biden is truly our elected president, I will support him with all of my soul. Without any question whatsoever, I absolutely support the fact of wearing masks and doing anything and everything we can to stop this dreaded killer. But absolutely, without any question in the world, if Joe Biden is truly our legally elected president of the United States, we should all celebrate and support him. You know, I am not going to sit on the sidelines and root for one or the other. You know where I stood, and absolutely I stood, staunch as I could be, with our president and everything, but absolutely all Americans should want. They should want with all in them to not walk away from an election in the United States of America for the President of the United States and sit around and say, well, the election was rigged. There was all these votes that shouldn't have been counted and everything else. We're not a banana republic. We're the United States of America. And for crying out loud, we need to absolutely know that and get to the bottom of this. And if the bottom leads us in another direction, we celebrate that. If the bottom leads us to where, Vice President Biden is the president, we need to celebrate that. I can't be any more clear. I am not going to run out and say today, that Vice President Biden won, because today we have a lot of doubt in our mind and we need to get to the bottom of it.
All right, thank you. Next to David Beard with the Dominion Post.
Hi, Dr. Marsh has already touched on my question. I read just while I was waiting for the briefing to start, I read just a 2-sentence summary saying that just yesterday the CDC updated its guidance on masks, and it said that masks protect the wearer. And I think that what I read said the CDC cited 7 studies about masks in the process of updating its guidance. And so I wondered if you could, Dr. Marsh, kind of amplify what the CDC learned that led it to change its mind or update its guidance, however you want to phrase that. What did they learn new about masks? Thanks.
Governor? Good. So thank you, David. There is a whole bunch of different types of information, both in case studies and also in modeling studies, that demonstrate the benefit of wearing masks. And we have known for a long time that certain type of masks, including a mask that General Hoyer and our team at West Virginia University are putting together, and West Virginia University Medicine, around a very high barrier protection mask, an N95 kind of mask. So we've known for a long time there are masks out there that protect the wearer from being infected with airborne, droplet, or aerosol type spread diseases, which is what COVID does most commonly, to spread from person to person. What hasn't been clear is what is that benefit for cloth masks, for other types of non-N95 level masks, and these N95 masks have to be particularly fitted to the face of people who wear them to have the maximal barrier protection. And so then there was a whole sort of study done to suggest that the N95 or the non-N95 mask, the cloth mask, the mask over the ears that you can buy off the internet, may not be good at protecting you from other people, but they were really good at protecting other people from you. And what the CDC has found now, which I think is really important, and we've kind of touched on this through the different press briefings, is that while it is absolutely true that the wearing a mask is a measure of your altruism, service, love for others, because it absolutely does reduce the droplets or the aerosols that you generate if you are a person who doesn't know you have COVID, pre-symptomatic, asymptomatic, but you do have COVID and you can spread it. So it protects you from infecting other people. But what's become more clear is that there's also a benefit of these masks to reduce the doses of the virus, the concentrations of the droplets that can penetrate the mask to infect you. And we've talked a bit about some people have at least projected there's a possibility that wearing masks in areas where people are infected may cause that really low amount of virus to come through the mask that people are wearing. So it may even serve as kind of a small vaccination dose in some people. I don't think that's as well supported, but the CDC has looked at the weight of all of the data, lots of studies in mask wearing, both in big groups and also in small areas, including 2 hairdressers in Memphis, I think, who basically were both infected and saw over 100 customers and nobody got infected from them. So I think that this is really updating what we already know, is that mask wearing, physical distancing, avoiding crowds, avoiding closed indoor spaces, and avoiding being in constant contact, and that's greater than 15 minutes cumulatively in a 24-hour period from people you don't live with 6 feet or less, are ways that we can stop the spread of COVID-19 and protect the vulnerable citizens the governor has implored us to do.
All right, thank you, David. Next to Katie Coyne with the Charleston Gazette-Mail.
Thank you. Governor, if you can't hear me, I am happy to repeat my question, but I want to touch on a lot of stuff that we've already talked today. We've been breaking records for COVID measures for the last week. I know testing is up, but as Dr. Marsh said, the results that we're seeing in that also lead us to believe that community spread is up. The last few days, most of the stuff that you've been saying is putting a lot of the responsibility on mitigating this virus on individuals' backs. Going out and getting tested, wearing your mask, doing all these things. At the same time, we're acknowledging that people aren't doing that more. People are fatigued, they're tired. Because you are West Virginia's leader in this pandemic, can you tell us right now, when is it time for you to step in and implement enforceable rules to mitigate spread in communities?
Well, I did hear the question better, and that's good and everything, but I want you to realize that the governor can't just at his discretion create criminal offenses. So from the standpoint of going in and arresting people for not wearing their mask or whatever like that, the governor can't do that, I do not think. Now, from the standpoint of what the governor can do, the governor can issue an executive order, making it mandatory that people wear masks, if they go into a building. From the standpoint of going further than that, I don't really know exactly what the governor can do. From the standpoint of encouraging private businesses who have the absolute right to not allow people in their businesses, if they don't have a mask on, the businesses should step up and do exactly that. We can do things with certain businesses like bars or whatever, maybe restaurants, that require certain licenses within the government. We can move towards revoking their license, if they don't abide by the guidelines. But from the standpoint of, again, and I am not laying these burdens on anyone, from any health department. The county health departments, need to try to do any and everything that they can do. And I absolutely understand with all in me how people are tired and they're frustrated, and all that may is at play. But I want to go back to just this. first and foremost, there's not a state, there's not one single state in this country that probably has, let's just say that we're surely in the top 25 percentile in our numbers that we have produced over and over and over within our state. There is not a state in the country that has had an absolute closure from the standpoint of, if you're the mandatory use of mask. Now, from the standpoint of just this, and I've got to say this, but our people, our West Virginia people, are tired. Our people across our country are tired. It is amazing how we can catch another gear when we're really, truly afraid and truly threatened. Today we have become lackadaisical to some degree, and that makes us tired. Now, from the standpoint of our workers, our National Guard and our local health departments and DHHR and all of us, everyone is tired. Everyone is frustrated. But all I can say is just this: you're not really tired. You have made yourself mentally tired and everything, but if the threat, and today of all days, Veterans Day, if the threat was an enemy at our border that was threatening our lives and everything, we would pick it up like you can't imagine. We would have so much freshness and everything, so much immediate that. But you see, that's exactly what we've got. I'll never forget this. I'll never forget this till I die. But my grandmother died. And my grandmother and I were really, really close. And I was a lot younger guy. And it just ripped my heart out. And when we went to the funeral, the preacher just happened to be, probably the senior preacher was maybe out of town. And a young kid, was at the pulpit. And I'll never forget this until I die. He got up there and said, God, bring her back. This family is really hurting. And this family loved her and loved her beyond belief. Bring her back. Please bring her back right now, God. Please bring her back. And I thought to myself, this kid is a lunatic. And then he looked up and looked right at us and said, you see, that's exactly what God has already done. Well, you see, from our standpoint of being tired and knowing that if we had an invading enemy right on our borders, we would pick it up like you can't imagine. We wouldn't be tired. We wouldn't be frustrated. We wouldn't be any of those things. But you see, that's exactly what we have. Exactly where we're at. The enemy's right at our borders. And the enemy is coming at us right now. We got to pick it up. We got to pick it up, and we got to pick it up right now. I don't know what else I can do. I have given it every single thing that I have. I don't know what else I can do. Legally, I can't go out and start arresting people. I don't know what else I can do. We have got to absolutely test more, and we've got to absolutely wear our mask, and we've got to do all the things that are out there available to us to try to slow this thing down until we get to the vaccine. If you can tell me something else other than just going out and wholesaling, shutting things down, shutting down our businesses that will cause us more and more and more repercussions, and it may very well be that we have to move in that direction. It may very well be that we have got to revisit and think about just this, from a standpoint of our kids, when we go home at Thanksgiving holidays, should we come back for the next 2 or 3 weeks and then go home again for Christmas? Our universities are going home at Thanksgiving holidays and not coming back till after the first of the year. And if this continues, and it continues in a really more and more and more profound way, that is something else that we need to look at. We're looking at everything. I don't know how to answer it any better.
All right, thank you, Katie. Governor, I'll turn it back to you.
Well, only thing I would add is just this. From the standpoint of wearing your mask, I mean, I always make notes of what others are saying in these briefings. Dr. Marsh said something that is so profound it's unbelievable. He said that 2 different hairdressers both had COVID and did not know it. Both of them were right in the face of 100 customers. They were right in the face of 100 customers and absolutely 0 for 100 got it. You know why? Because they had their mask on. Those hairdressers had their mask on. And they treated 100 customers and nobody got it. What does it tell us? Wear your mask. For crying out loud. I know you're tired, West Virginia. You've done great, but wear your mask. Absolutely, some way, somehow, we're going to get through this. Say a big prayer for all those that we've lost. Say a prayer, too, for those kids that really, gave everything in the world and just want to play in a state tournament. Say a prayer for all those that are out there that are wanting to go to school and worried, and especially our elderly that are sitting out there waiting maybe on a warm meal that's coming from our senior services. Absolutely, we'll get through this. Tough decisions have to be made. And some way, somehow, we'll get through it. Thank y'all.